Hobson. I'm an LP and a BSN student at Indiana State University. This is my Community Health 444 Community Health Project on pneumonia. At this time, I ask that you pause and take the pretest found in the description box below and assess your knowledge before viewing this presentation. You will be prompted to take the same test, post-test, after the presentation has finished to assess how much knowledge you gained from this presentation. Pause at this time, please. Now that you've taken the pretest, the learning objectives that I hope this presentation will provide is that members of the community will be able to describe how breathing works, define what pneumonia is, present possible causes of pneumonia, identify signs and symptoms of pneumonia, explain risk factors for pneumonia, report possible complications from pneumonia, compare treatments for pneumonia, and state when to seek medical help. To understand pneumonia, we need to first understand how breathing works. We need oxygen or O2 for our body tissues and organs to function and survive. Our airways are like a tree with branches in each lung. When we breathe in air around us, the O2 goes to the tip of those branches into the tiny sacs at the end called alveoli. As the blood in our blood vessels flows past the alveoli, oxygen is pulled from the air in the alveoli into the blood. In exchange, our blood gives up its waste, carbon dioxide or CO2, that it picked up as it traveled throughout our body to our lungs. The blood vessels then carry the O2 rich blood back to our body to provide the O2 needed for the body to function properly. We then breathe out the air in our alveoli. As it leaves our body, it carries the CO2 waste with it. In the figure to the right, you notice that the blood is coming in blue, which means that it is high in CO2 and low in oxygen. It then moves past the alveoli, picks up the oxygen from the air in the alveoli, and goes back out to the body, rich in oxygen to supply oxygen to the rest of our body. What is pneumonia? Pneumonia is what happens when an organism enters your lungs and causes an infection in the alveoli. And an organism is just a germ. Your body then sends special cells and fluid to your lungs to fight the infection. That's an inflammatory response. The alveoli, they usually fill with air when you breathe in, then become full of fluid or pus. And when they're filled with this fluid, they become clogged so that the oxygen can't fill them when we inhale. The blood then is unable to access oxygen in the air that we breathe in, and so it can't carry oxygen to our body, and our body can't function properly without the oxygen. The infection can be caused by a virus, a bacteria, or a fungus. Fungal infection is pretty rare, so we'll just focus on the viral infection and the bacterial infection. The most common types are viral pneumonia and bacterial pneumonia. And viral pneumonia, it can be very dangerous for young kids and old elderly people as well. And it can also lead to bacterial pneumonia. And bacterial pneumonia is very common in adults. How do you get pneumonia? The infecting organism or germ can enter your lungs by breathing it in from the air. So if someone who has infectious pneumonia coughs it into the air, you go behind them and breathe it in, you can develop pneumonia. You can develop it by aspirating. And what that is when you swallow something and it goes down into your lungs instead of into your stomach. Your lungs are sterile and clean, so anything that comes into it that isn't sterile or clean will cause an inflammatory response and end up causing pneumonia. You can develop pneumonia from an infection in your body that is near your lungs. So if an abscess is in your chest, near your lungs, it can easily pass to your lung and develop pneumonia. Same thing with your blood. We saw that the blood flows past the alveoli. If there's an infection in your blood, it can easily pass to your lungs and cause pneumonia. You're at a greater risk of getting pneumonia and having complications if you are elderly, which is someone who is older than 65, if you're a young child, which is someone who is less than 2 years old, if you had a recent respiratory illness, if you smoke, if you have diabetes, if you have heart problems, if you have lung problems, if you have poor oral hygiene. And this oral hygiene causes it because people who have poor oral hygiene and don't brush their teeth or take care of their teeth very well tend to have bacteria that build up in their mouth. They can easily make their way into the airways, down into the lungs, and cause pneumonia. How do you decrease your risk? You wash your hands, wash your hands, wash your hands. Regular hand washing or sanitizing with soap and water is not available helps to decrease the spread of the organisms that cause pneumonia. Because if someone contaminates a surface and with pneumonia organisms and you come behind them and touch that surface, touch your mouth, your nose, your eyes, you contaminate yourself with pneumonia. But if you wash your hands, you wash those organisms away. If you're a smoker, stop smoking to decrease your risk. Smoking affects how well your lungs can clear the bad organisms out and how well they can fight off infections caused by those organisms like pneumonia. Also, if you stay up to date on all of your vaccines, you decrease your chances of getting pneumonia. Because remember, pneumonia can result from having previous respiratory illnesses. Signs and symptoms of pneumonia can be a new wet cough with pus-like sputum produced, a severe sudden chest pain while breathing in and out, shortness of breath, difficulty breathing, fever, chills, fatigue, aches, confusion. So any new confusion all this can be signs of pneumonia. Pneumonia is diagnosed gold standard with the chest x-ray. They take a picture of your chest and they can see fluid collections in your chest, and that's one of the more definitive tests. They also may use blood tests, especially like a white blood cell count. Those are the cells in your body that fight off infection. So if your white blood cell count is high, that is indicative of an infection and can be um, a signal of pneumonia, among other blood tests. Also, a sputum culture may be collected. They may take a sample of what you cough up and culture it in a lab and see what grows from it. And it actually can pinpoint the actual organism that is causing your pneumonia and make your treatment more effective. Treatments normally depend on the type of organism that makes you sick and how sick you are. For viral pneumonia, it typically goes away on its own, but typical sickness things like rest, drinking plenty of fluids, eating well, breathing treatments may be necessary to help with your lungs, expectorants to help cough up the sputum, steroids to decrease inflammation and oxygen. And for bacterial infections, it's the same things as the viral pneumonia treatments with the addition of antibiotic therapy. These antibiotics can be oral for mild illnesses or for moderate to severe IV antibiotics. You may even need to be hospitalized to receive them. And let me say this, antibiotics will only help if it's a bacterial infection because antibiotics only work for bacterial infections. So only bacterial pneumonia gets treated with it. Pneumonia treatment usually can be managed at home. However, you should seek medical attention from your primary care doctor or urgent care center or ER, as you may need to be admitted to a hospital for treatment if your symptoms are not improving, if your symptoms have worsened, if you are having trouble breathing, if you have other health problems that are being affected. Pneumonia can turn serious very quickly. It is very important that you are being followed by a healthcare provider to manage your symptoms so that you do not end up in a very bad situation. Possible complications that can land you in trouble with pneumonia is that it may progress to bacteremia. Bacteremia is when you get bacteria in your bloodstream. It can go away on its own. However, when your immune system is already under attack, it can progress to septic shock, which can be deadly. Septic shock is when your body is so overwhelmed with infection that your organs start to shut down. So, like kidney failure, lung failure, and you can end up on a vent or even possibly die. That's pretty much the basics on pneumonia. Prognosis is good as long as complications don't occur. Please take the post test at this time. You'll find the link in the description box along with the answers and a flyer that has all of the highlights of this presentation. Thank you and have a good day.